Your period was fine. Then you cleaned up your diet, cut carbs, maybe even felt proud of the discipline. And suddenly your cycle goes off the rails. Late, early, missing, random spotting, cramps that feel unfamiliar, PMS you did not sign up for. And the worst part is being told it is normal, or that it is stress, or that you are overreacting. If low carb started recently, and your body changed fast, this is not just in your head. Moving to slide 2. When the change happens is a clue. The first 2 to 6 weeks of low carb is a common window for disruption. It also shows up right after rapid weight loss, a big stress spike, a jump in training, or any sharp calorie drop. Different triggers, same pattern. Your system notices the shift and starts prioritizing. Your cycle is often the first place you see that priority list change. Energy availability comes first. Moving to slide 3. If your total calories drop too low for your activity, your body does not negotiate. It triages. Breathing, blood sugar control, body temperature, and brain function stay funded. Everything else becomes optional, including reproduction. The tricky part is the deficit can feel normal, especially if you like structure, if you are busy, or if appetite is muted on low carb. So do not use hunger as your only signal. Action steps. Track your intake for a week, honestly, then compare it to your training volume. If you have been losing more than about 0.5 to 1% of body weight per week, slow it down. Add 200 to 400 calories per day for 2 weeks and reassess. If your period is missing or spotting persists, stop chasing a bigger deficit. Carbs can be one of the fastest ways to signal safety. Moving to slide 4, carbs are not magic, but they are a powerful signal. When you eat carbs, insulin rises, and that is one way your body detects that fuel is available right now. Leptin, another signal tied to energy stores and intake, tends to drop when calories and carbs drop, and that combination can push reproductive hormones to downshift. Ovulation is especially sensitive to instability, not just low totals. So focus on steadiness. Avoid big daily swings where one day is tiny and the next is a refeed. If your cycle has changed, try adding 30 to 60 grams of carbs to the same meal every day for 2 weeks, ideally around training or at dinner, and keep total calories up. Choose fruit, potatoes, rice, oats, or dairy if you tolerate it. Stability beats perfection. Stress hormones can still steal the cycle. Moving to slide 5. Even with enough food, high stress can suppress your cycle. Cortisol does not literally replace sex hormones, but it shifts signaling and resources away from reproduction when your brain thinks survival is the priority. Sleep loss cranks this up fast, and it also worsens insulin sensitivity and cravings, which can push you into harsher restriction the next day. Be careful with stacking stressors. Fasting can be fine for some people, but if your period changed after starting it, remove it first. Overtraining is another common culprit, especially if you increased volume, added HIIT, or stopped taking rest days. And anxiety can quietly change appetite, so you eat less without realizing. Your move: protect 7.5 to 9 hours in bed, add 1 full rest day, and eat a real post-training meal with carbs and protein. Fast loss creates fast signals. Moving to slide 6. When you lose fat quickly, your hormones notice fast. Body fat has aromatase, an enzyme that converts androgens into estrogen, so less body fat can mean less ongoing estrogen production. At the same time, fat tissue stores steroid hormones and related compounds, and during rapid loss, those stores can shift and release unevenly. That mix can make your cycle wobble for a bit. You might see a late period, an early bleed, or a month that just feels off. If your weight keeps swinging week to week, the signals keep changing. When your weight and calories stabilize, your brain and ovaries usually settle into a more predictable rhythm again. Fast loss creates fast signals, and stability is often what restores the pattern. Moving to slide 7. Ovulation is the event that sets the clock. If you ovulate late, your period is late. That is the most common reason a dieting cycle stretches out. The phase after ovulation, the luteal phase, is usually pretty consistent for most people, often around 11 to 14 days. So the big variable is when ovulation happens. If you do not ovulate at all, You can still bleed, but it tends to be unpredictable. It may be light spotting, a long slow bleed, or a random heavy day that shows up without the usual premenstrual pattern. So do not judge your cycle by calendar math alone. Track signs your body actually gives you. Cervical mucus that turns slippery and stretchy often rises before ovulation. Basal body temperature typically shifts upward after ovulation and stays there until bleeding. Mid-cycle pelvic twinges, breast tenderness timing, and the way your mood and appetite change can also help you spot the pattern. And remember, bleeding is not proof you ovulated. Ovulation is what makes the schedule, and your symptoms can tell you whether that schedule is real. Moving to slide 8. Spotting has patterns too. Low progesterone after ovulation can cause brown or pink spotting before your period. Stress can also trigger breakthrough bleeding, especially when calories, training, and sleep are all strained at once. Perimenopause can overlap with fat loss changes and make timing messy. New or changed birth control can add its own bleeding rules, and if pregnancy is possible, rule it out first, even if the bleeding seems light. Moving to slide 9. If your diet feels like it is working, but your body feels like it is shrinking its budget, you may be too low carb for you. Watch for cold hands and feet, a dip in libido, flatter mood, and sleep that gets lighter or more fragmented. Hair shedding can increase a couple months after a big deficit, and your training performance can slide, especially in higher intensity work where glycogen matters. This is not about carbs being magic. It is about matching fuel to stress. When carbs stay very low, while you are also dieting, lifting, doing cardio, fasting, and living a normal, stressful life, your body often compensates by turning down non-essential outputs. In women, that can include reproductive signaling. A useful test is whether symptoms improve when you add targeted carbs for a week, without changing anything else. If warmth, sleep, and training bounce back, you have your answer. Your results should not require you to feel chronically depleted. Moving to slide 10. You do not have to quit. You have to stop stacking stressors. Pick 2 levers to pull, not 5. Start with carbs, placed where they buy you the most. Add 25 to 50 grams of carbs on training days, preferably around your workout or at dinner to support sleep. If your cycle is already off, bring calories up slightly, even 100 to 200 per day, and hold that steady for 2 weeks. If you are fasting, reduce frequency before you reduce food quality. Eat earlier in the day or cap the fast at 12 hours for a while. Then look at training. Take a 1-week deload, keep the habit, cut volume and intensity, and let recovery catch up. Many people see temperature, sleep, cravings, and cycle symptoms normalize when recovery is finally allowed to win. You are not failing by adjusting. You are proving you can keep fat loss sustainable enough for your body to trust it. Moving to slide 11. When your cycle does something weird once, it is often still normal. A single odd cycle can happen after travel, a stressful month, a new workout plan, or getting sick. A mild timing shift, like being a week early or late, is usually just noise. If you are in a weight loss phase, especially with a bigger calorie deficit or rising training load, your cycle can stretch out or ovulation can get less consistent for a bit. The key is how you feel and what the trend does. If you have no severe symptoms, and over the next month or 2 things start drifting back toward your usual pattern, that is reassuring. One data point is not a diagnosis. Keep calm, keep tracking, and pay attention to patterns that persist. Moving to slide 12. Get checked if you go 3 months with no period, even if you feel fine. Also get checked if bleeding is suddenly heavy, you are soaking through pads or tampons quickly, passing large clots, or bleeding between periods. Severe pelvic pain, fainting, dizziness, or new one-sided pain matters, especially if it is getting worse. If pregnancy is possible, test early and take symptoms seriously, including spotting with pain. And if you have a history of thyroid disease or PCOS, new changes deserve a lower threshold for labs and a clinical review, because those conditions can shift fast with stress, dieting, or weight changes. You are not being dramatic by asking for help. You are being efficient with your health. Moving to slide 13. Build a simple cycle dashboard. Track cycle length and flow, plus 1 or 2 ovulation signs like cervical mucus patterns or LH tests. Log your average calories and protein. Keep carbs reasonably consistent week to week, and note sleep and training load. You are trying to spot what changed right before your cycle changed. A few clean signals beat a messy notebook every time. Moving to slide 14. Pick one adjustment you can actually keep, like raising calories slightly, tightening sleep, or pulling back training volume. Run it for 2 full cycles, then look for ovulation to return and your timing to stabilize. If you want help, comment your pattern, like cycle length, whether you are dieting, and what changed recently. Subscribe if you want the follow-up walkthrough on common patterns and fixes. This content is educational and not medical advice. If you have severe symptoms or think you may be pregnant, seek urgent care and talk to a qualified clinician for personal guidance. Energy is a metabolic outcome, not luck.